Thank you very much, Program Director, MEC. I can see that you're starting to get inspired by another spirit, which of course can also be a very positive spirit in the fight against tuberculosis. Let me take this opportunity to pass my greetings to our brand new Deputy President and also Chair of SANAC, to Deputy President Mashatile, to say I did welcome him a few times in the IMC Interministerial Committee and also in the plenary, but here now at this event in front of Batho ba Bojanala. Dumelang Batho ba Bojanala. Dumelang Batho ba Tlhabane. A ke re le amogela Motlatsa President Mashatile. Halala Motlatsa Deputy President Mashatile, halala. Ka na mokgwa o Deputy President re a go amogela. Re a amogela mo family ya SANAC. Time is not on our side, so let me acknowledge our Premier and also our ministers and deputy ministers who are here. Thanks. I saw quite a number of deputy ministers present, MECs. I think the MEC of Eastern Cape was here. I'm sure she had to attend to other matters. The mayors, mayor of the district, the acting mayor, and also the mayor of Rustenburg, who had welcomed us earlier on. The co-chair, Comrade Steve, thank you very much for your input earlier on. All our leaders, religious leaders, Khosi, Releboga Molaitsa wa Khosi, Legatong la Ntlo ya Makgosi. All our partners, all the partners who are here, PEPFAR, CDC, the US Consul General, also the United Nations family. Dr. Kalua asked to be excused, but we still have Eva Kiwango from the UNAIDS, the private sector, the labor, and all other partners within SANAC. Today is indeed the day for the maiden speech for the World TB Day for the Deputy President. So I'll just touch on a few points before I ask Deputy President to come and give us the main address. We know that the main reason we are here is again to commemorate this very important day when the bacteria which causes tuberculosis was first discovered by Robert Koch in 1882. We are here to assess how far we have gone, but also to recommit ourselves. Now, as already speakers have already touched on, while tuberculosis is a disease which is caused by a germ or a bacteria which infects the lungs and other parts of the body, as you had the testimony here of our brother here who was indicating that he had TB, but it was not TB of the lungs only. It was also in the brain, TB meningitis, because tuberculosis is not only in the lungs, but it's also in other parts of the body. We are here to recommit ourselves in terms of making sure that we can eradicate this as a public health threat. But we also know that right from the time of the discovery of the bacteria, even the early scientists did recognize the fact that while it is a disease caused by a particular germ, but it is also a socio-economic disease, as the Honorable Premier just said earlier on here. And that's why we are happy that our colleagues also in the private sector, especially in the mining industry, are also here with us. We know that while TB is a global threat to health, we as a country account for a major part of that burden. And we want to make sure that as we are here today, we're going to recommit ourselves to deal with the disease in terms of on the medical side, but also the reason why also we had to start at Yizo in the informal settlement here was again to remind ourselves that this is also a socio-economic disease. It's driven by socio-economic conditions of overcrowding, poor housing, poor ventilation, and of course also in terms of the working environment. So our main commitment here today is to say from the Department of Health side that especially on the side which has to do with the medical intervention, we are very grateful that over the years a lot of progress has been made in terms of on the biomedical side of intervention. As already mentioned, we have moved from where people would get very toxic injections which will damage, in curing TB, would result in damage to other parts of the body, especially in terms of hearing, and also taking, as the testimony earlier on, multiple tablets. We are very grateful that through the work of our medical scientists, we have progressed such that currently that time of taking 24 tablets is no more applicable, much more reduced in terms of the number of tablets one needs to take, and all those injections which used to cause a lot of damage has already been done away with. But we are cognizant also of the fact that a lot more still needs to be done. We are happy that our scientists are still researching, although we have a BCG vaccine which helps to prevent TB, especially if given in children, but it's not 100%. We want further improvement, and we are happy that our scientists are working on that to improve in terms of prevention, but also in terms of treatment. Because of the fact that as a result of the pandemic, we lost some ground in the coverage of treatment, we have already, as was mentioned, we launched last year the TB recovery plan, which was premised largely on finding people who were missing, because we are aware that while it is estimated that in South Africa, over 300,000 people get infected with the TB every year, but we're only finding, a few years ago, before the pandemic, we're able to diagnose up to 260, 270,000, but as a result of the pandemic, we went lower, below 200,000 people who could be diagnosed. And we launched the recovery plan so that we can be able to improve on that, and it's working. The good news is that even in the last year, the indications are already that we have made a lot of improvement. We're already upwards of 215,000 of those who have already been diagnosed in the past year, to show that there is indeed improvement. Also in terms of drug-resistant tuberculosis, we have made improvements because we had also lost ground in that area. So there are a number of steps which we have taken, including making sure that to get more coverage of people who have tested positive, launching an SMS program through which, once your results come to say positive, you receive an SMS which will inform you that you indeed have TB. Coming closer home, Premier, you have already mentioned that Northwest, because of two issues which I've already mentioned, especially the mining area, because over the many years of South Africa being a mining country, especially in the gold mines, deep gold mines with a lot of dust, especially the silica dust. A lot of our people, men who worked in the mines, ended up with the lungs being destroyed by this dust, but also making their lungs vulnerable to tuberculosis. So we're doing a lot of work in terms of making sure that we can screen mine workers and also former mine workers, because many of them did not even, when they retired, did not know that their lungs were damaged. So there's a lot of work. And I want to say also that while we're doing that, let's also spread the message that there is also compensation funds which are available for ex-mine workers. So all those of us who have family members who have retired from the mines, please encourage them. We have got the leadership here of the ex-mine workers who are working with us to make sure that we can trace those and make sure that those who have got TB can be diagnosed and treated, but others who don't have TB but other chronic lung diseases as a result of the dust in the mines can also receive their compensations. And we're happy that, Premier, that the province also has been making a lot of improvements The statistics which are showing indicates that there is improvement in the diagnosis here in the Northwest, in all the regions. Of course, Bujanala region is the leading region because of the fact that it's the biggest, but also because of the many mines in this area. Also in this province is showing that we have reduced the number of people who we have lost to treatment, and that also the death rate has been reducing. So indeed, our theme of saying, yes, you and I can end TB is very relevant, and we must make it a reality. Now, as I'm about to invite the Deputy President, let us also be reminded, as the DP will go deeper into that, that this is the twin function today. We are not only here to commemorate the World TB Day, but we are also here to launch the National Strategic Plan for HIV, AIDS, sexually transmitted infections, and also tuberculosis. So indeed, this is a very important day in terms of our rededication, our recommitment to make sure that we can fight the twin epidemics of HIV, AIDS on the one hand, and STIs, but also tuberculosis. Now, our Deputy President, while he is indeed new from the box, he's not exactly new in terms of public service. He's been around from the time of the democracy after 1994. He served in various positions in the Gauteng province as a MEC for finance, a number of other human settlement at some stage, and even at some stage, our new DP served as the Premier of Gauteng. And after that, he then also migrated to national government, where I worked with him for just over 3.5 years. He was the minister and I was his deputy in the Department of Arts and Culture. So he's really not new to the public service, but we welcome him into this new challenge of fighting the scourge of HIV, AIDS, TB, and STIs. Welcome, Deputy President. I think the people are ready to come and listen to your message.
Thank you very much. You may be seated. When I looked at the program earlier, it indicated that I must speak at 1 o'clock. Now check my watch, now is 8 minutes past 3. So I'll have to try and summarize my speech because it means people have been here for too long. So I will try. Firstly, let me thank the Premier, our host in the province, for having welcomed us here. Also thank the Executive Mayor of Rustenburg, who is also our host in this city of Rustenburg. Thank the Minister of Health, my colleague, whom we have worked together for many years. And once again, we find ourselves together, Minister, so we will travel this journey together. Khosi Mautwe Realeboga, the chair of the House of Traditional Leaders, to be with us, and the entire leadership of SANEC, from national to province, in particular my co-chair, Comrade Steve, who said to me earlier when there was a small demonstration, he says to me, there could be no better way of welcoming you. So thank you very much, Comrade Steve. Chair of SANEC Trust as well, and many others. So what I'm going to do, instead of recognizing all of you, I take it that many have been recognized by the previous speakers. So we should be able to proceed. So I start by greeting all of you, Dumelang, Sanibonani. My earlier speech said Abshen, but in my language, Abshen is in the morning. So I have to change that and say Inhlikan. You must say Aye. And the Masiari. Abuti. Program directors, let me thank both of you. MEC Madota Sambata and Neum Mwepi from People Living with HIV. I thank you for steering the ship. On behalf of the SANEC community, I would like, first and foremost, to convey my sincere gratitude to former Deputy President David Mabuza for the leadership he provided as the chairperson of the South African National AIDS Council, as well as leading the process towards the National Strategic Plan 2023 to 2028 that we will be launching today. His vision and leadership helped to forge stronger ties with key partners in the fight to end HIV/AIDS and tuberculosis. These valued partners include our esteemed traditional and COI leaders, the business community and civil society. His efforts ultimately ensure that all sectors join and put all their efforts to make the SANAC family a success. We must continue to strengthen collaboration with all national and international stakeholders. Program Director, as all of us are aware, tuberculosis remains one of the leading causes of ill health and death in South Africa. This is exacerbated by the fact that some TB patients do not complete their treatment while others remain missing, which means that they are either undiagnosed or are unreported, even if they are diagnosed. So today, our country joins the rest of the world in observing World TB Day under the theme, Yes, You and I Can End TB. The theme is aimed at encouraging individuals or individual action to strengthen the national strategy against tuberculosis. It underlines the significance of taking personal responsibility and joining forces to eradicate tuberculosis as a public health threat by 2030. We must recommit ourselves to raising greater levels of awareness about the disease alongside the terrible health, social, economic implication, and strengthen other efforts to prevent the further spread of the disease in our communities. This province faces specific challenges in the fight against tuberculosis due to mining activities and a high number of informal settlements. I think when I was briefed earlier, I was told that just here in Bujanala we have about 27 informal settlements, which result in overcrowding and unfavorable living conditions which expose people to health hazards. However, the province has made noteworthy progress in reconstitution of its Provincial Council on AIDS with the involvement of all stakeholders. Other provinces can learn valuable lessons from this positive step. The government is determined to build a world free from devastation of preventable and curable diseases such as TB. We must continue to embark on tuberculosis catch-up programs as we continue to pursue shortened treatments after infectious diseases took a backseat due to COVID-19 pandemic. However, regardless of the setback, we have made conscious efforts to rebuild and intensify TB interventions across the country. Through the UNI Statement of Intent, we seek to encourage individuals to take charge of their health in line with the objective of the Cheka Impilo National Wellness Campaign, as well as the country's endeavor towards finding the missing TB patients. It is critical that everyone infected with TB is aware of the infection. It's introduced to treatment and goes to complete their treatment. Finishing the course is important in order to avoid developing multi-drug resistant TB and extensively drug-resistant TB, which are both very difficult to treat, and they are also life-threatening and fatal. We must promote awareness for personal responsibility in the eradication of TB. This will undoubtedly deliver better progress in the fight against TB. Together, we can recover the ground lost by the TB response as a result of the COVID-19 pandemic. We should bear in mind that our country is mostly off track in terms of attaining the set TB targets, including those related to the 2018 United Nations High-Level Meeting on TB. It is concerning that the last South African TB prevalence survey positioned our country as one of the 30 high TB burden countries, accounting for 87% of the burden. It is one of the 10 countries with a triple burden of TB, HIV, and MDR TB. We shall accelerate interventions to eliminate TB by fast-tracking the implementation of the TB recovery plan that was launched in 2022. We have already started finding undiagnosed people with TB through interventions that scale up community screening, introduce targeted universal TB testing, and the use of other technologies. One of the useful approaches to mobilizing political will for TB response is the strengthening of the South African TB caucuses in all the provincial legislatures. I'm happy to hear that, in fact, here in the Northwest, the provincial caucus is very strong on the issue of TB. The caucuses provide a platform for elected public representatives to champion the TB response in their provinces and constituencies, led by the speakers of the provincial legislatures, as you have heard today from our speaker, Janchi, this afternoon. We are pleased to report that 5 out of the 9 provinces have successfully launched their TB caucuses. And these include Northwest Province, Gauteng, Limpopo, Mpumalanga, and the Western Cape provinces. The National TB Caucuses in Parliament is due to be relaunched this year. I know that the Minister of Health has been working very closely with our team there, the Chief Whip and the team. So definitely it will be launched this year. We congratulate all these spheres, these provinces, and urge the remaining ones to follow suit. Program directors, a few days ago, we observed Human Rights Day. And as somebody said correctly, this is a Human Rights Month. As we continue to observe this Human Rights Month, we should remember that access to healthcare services is a basic human right guaranteed by our Constitution. Stigma and discrimination remain some of the hardest social and structural barriers that limit access to TB screening, to treatment and care, thus compromising the lives of people who are affected by TB. We think it is unacceptable that in the year 2023, we are still talking about stigma. We should therefore collectively champion interventions against social isolation associated with TB at community level. We must also continuously maintain well-coordinated multi-sectoral interventions against stigma and discrimination in our communities. Program directors, we will continue to work together to look at how to strengthen the systems that link people with care, strengthen the system that keep them in care, and scale up initiatives that encourage the use of TB prevention therapy. In September this year, world leaders will gather at the United Nations General Assembly for the United Nations High-Level Meeting on TB. The last meeting was held in 2018 during South Africa endorsed the political declaration on TB. Key amongst the targets committed to in that declaration were the following: treat 40 million people with TB between 2018 and 2022, treat 3.5 million children with TB, treat 1.5 million people with drug-resistant TB, and also at least 30 million people put on TB preventative treatment. Program directors, we cannot overemphasize the importance of collaboration in the TB response. We can do more by leveraging our combined strength and resources. The active roles of civil society, private sector, development partners, research institutions, community members, TB survivors, and people infected with TB all remain paramount in our fight to end TB. To that effect, through the 4th National Strategy Plan, NSP, we continue to guide our collective response to HIV, tuberculosis, and sexually transmitted infections. Viewed together, the plans set out in the NSP provide insight into the path we have traveled as a nation to overcome one of the most devastating human challenges of our time. The previous NSP is a clear demonstration of the outstanding progress we have made. It is also a stark reminder of how far we still to go. Indeed, our response to HIV, TB, and STIs has evolved over the last 2 decades as we have come to understand the nature and impact of the epidemics, the factors that contribute to their spread, and the interventions that work best in reducing infection, morbidity, and mortality. In this regard, we are pleased to launch today the 5th National Strategic Plan for HIV, TB, STIs for the period 2023 to 2028 as adopted by Cabinet. The new NSP is a blueprint and roadmap for a multi-sectoral, people-centered approach to eliminate HIV, TB, STIs as public health threats by 2030. Program directors, it emphasizes the need to break down barriers and maximize equitable and equal access to services through resilient and integrated health systems to guarantee the health and social protection of all South Africans. The successful implementation of this NSP will require strong governance and leadership, and the involvement of all sectors of our society, including government, business, organized labor, civil society, development partners, research institutions, and communities in general. And I must say that I'm very happy to see that that is already happening in action. So this is not just talk. All the partners are here, and we must continue that way. The 2023-28 NSP features 4 strategic goals. First, to break down barriers to achieving HIV, TB, and STIs solutions. Second, to maximize equitable and equal access to HIV, TB, and STI services and solutions. Third, to build resilient systems for HIV, TB, STIs that are integrated into systems of health, social protection, and pandemic response. And fourth, to fully resource and sustain an efficient NSP led by revitalized, inclusive, and accountable institutions. Honorable Minister, I was briefed in the last meeting that the South African government has been one of the biggest contributors financially to this program, but I was asked if we can do more. I know Dr. Kulu was looking at me and say, it's good, but can you increase? So, Minister, me and you must talk to the Minister of Finance. This is a very important program. We need to support it. Program directors' work has already begun to give effect to these goals. SANEC is leading several activities as part of the NSP rollout. One of them is the year-long Sexual and Reproductive Health and Rights campaign aimed at sustained and impactful messaging and demand creation for reproductive health services, information about STI transmission, condom use, availability of family planning services, and availability of groundbreaking HIV prevention tools, such as the newer Dipivirine ring as pre-exposure prophylaxis, PrEP. Another project in the pipeline is the treatment literacy framework aimed at improving treatment adherence, eliminating stigma and discrimination, promoting health-seeking behavior, and enhancing treatment uptake. This is important to ensure that individuals on antiretroviral therapy remain virally suppressed so they can enjoy a good quality of life. Most importantly, when the viral load is undetectable, HIV cannot be passed on to one's sexual partner. Program Director Sanak is also preparing for the launch of the Situation Room, a cutting-edge data visualization and analytics platform that provide up-to-date multi-sectoral data in an easy-to-use format to support evidence-based decision-making and planning. Another critical signature initiative by SANAC is a continued effort to strengthen the provincial AIDS councils. The core objective of all this work is to pave the way for the successful implementation of the NSP. The NSP 2023 to 2028 calls upon all of us to build consensus and drive a well-coordinated, unified response to the 3 epidemics over a 5-year period. We must also be cognizant of the fact that this is the last NSP ahead of the 2030 target of ending HIV and TB as a public health threat, and we dare not fail. Failure is not an option. As Dr. Tulu always says, I'm quoting her verbatim, failure is not an option. Drawing lessons from previous NSPs, the COVID-19 pandemic and current epidemiological trends, the new NSP is considerably more radical than its own right. It is pandemic ready to guard against unknown future disruptions similar to those caused by COVID-19. It recognizes the need to strengthen health systems. It has an expanded scope for the management of sexually transmitted infections. It recognizes the need to scale up mental health services and social support based on interlinkages between HIV, TB, and STIs with other social challenges, such as gender-based violence and femicide, human rights violation, and inequalities. It was drafted through an extensive public consultation in all 9 provinces by bringing together multiple stakeholders, key populations, vulnerable groups, academics, ordinary people from all walks of life. Every input was carefully considered and integrated into the final product. The NSP 2023 to 2028 that we are launching today went through that consultative process. SANAC will coordinate the implementation of the NSP as mandated by Cabinet. However, its successful implementation lies with all of us. If we don't make sure that we put all of our efforts to drive this program, it will not succeed just because it's supported by cabinet. It needs all of us. It is about our lives, how we protect it, how we prolong it, how we value it, and how we improve it. Let us work together to ensure that this NSP is one of the last in our lifetime. Yes, we can conquer TB. Yes, TB is curable. And yes, you and I together can end TB. I thank you.
His Excellency, the Deputy President, Sanbonan, Ninjani, mina ngiyintombazane yakaMashu kodwa ngizosho ngoba ngilangithi dumelang. Crash ke nursery school ngangiyi-prefect, ngibhala ama-noise makers. So ngicela nje ningilalele kulo 5 minutes whilst we launch officially. So Deputy President, Co-Chair, I'd like to just officiate this process and ask Deputy President to please preside. I think in order to frame the seriousness of HIV and TB and STIs, sonke siyazi ukuthi there are times when people living with HIV and TB are so poor that they can't afford to get sick. Sometimes abantu abaphethwe i-HIV ne-TB, indlela abaphila ngobupha ngayo, they cannot afford to get sick, which means people must choose between umsebenzi nokugula. Therefore, this NSP had to be the people's NSP. It's the NSP of the people, for the people, and by the people. Communities are front and center, such that when we had 2 or 3 drafts, we still took it back to abantu. Sathi buyani nizositshela ukuthi, is this exactly what you wanted us to show? And they said, yebo, yeyethu le NSP. So I'm here to present to you. What you see in front of you is a beautiful display in terms of our cultural diversity as a country. You saw our young children with cameras, and we see the banners here. And I'd just like to say, phambili nge-NSP abantu, phambili. Phambili ngesidingo zabantu, phambili. Halala nge-new NSP, halala. Halala ngo-new chairperson weSANAC, halala. Phambili to ending HIV and TB as public health threats, phambili. So Deputy President, we are now going to hand over the copies and then request a photo moment. If the photographers could please come forward. Thank you very much, DP.